Уважаемые коллеги, данное пособие
Dear colleagues, this video is devoted to the discussion and analysis of the common issues of our discipline, operative surgery and topographic anatomy. First and foremost, we'll be talking today about topography. Today in this guide we'll try to cover common questions and general methodology of the study of topography, which should lead us to the laws that govern the regularities of the structure of various regions of human body, a lot of them, and examine these laws.
закономерностей строения различных областей тела человека, а их достаточно много. И изучив эти законы, изучив общие правила построения тела человека в различных участках, вы можете облегчить изучение нашего достаточно сложного предмета.
We will also talk about the general rules for categorizing the human body into different parts, with the hope that this would facilitate the study of our fairly complex subject. You would realize that there are lots of information that you would come across and understand in the study of our subject. You would also learn how to use these information for setting various goals and objectives in the study of other disciplines such as surgery, therapy, among others. The aim of any doctor is diagnosis and treatment of various diseases. The knowledge of the topography comes in handy in achieving this aim. During the study of topography you will be guided as we try to gain knowledge in the various rules and laws that exist in some areas, and talk about some exceptions that exist and need to be known.
Правила и закономерности, которые существуют в некоторых областях, а также поговорим о некоторых исключениях, безусловно, которые существуют, которые нужно знать. Что такое топография? Топография от слова
What is topography?
или место.
Topography from the word topo means place and refers to the pattern or the presence of some peculiarities at a certain region or a certain area of the human body. We studied, of course, all of the areas, and in every region that we studied we must primarily know the boundaries. There are many areas of the human body, and these areas are demarcated by certain lines, some of which are formed by the edges of the muscles and skin folds, while others are drawn by imaginary projections because there is no corresponding real linear external landmarks.
Линии, некоторые линии образованы краями мышц, кожными складками, некоторые границы проведены условно, так как отсутствуют соответствующие реальные линейные наружные ориентиры. Так, поясничная область
Border. To illustrate the concept of borders, let us consider the lumbar region. The lumbar area is limited superiorly by the 11th rib, laterally or outside by the Lsgaft line. Lsgaft line is an imaginary line which runs from the end of the 11th rib vertically down to the arc of the iliac crest, and inferiorly by the edges of the iliac crest.
Нижней границей области являются края подвздошных гребней. В практической медицине наружные
The value of external reference points. In the practice of medicine, external reference points or landmarks are extremely important. They are necessary for diagnosis. For example, we can project a conditional line between the intercostal space to determine the apical boundary of the heart, and deviations from this norm can be used to diagnose cardiac hypertrophy. External reference points also serve as external guidance in performing many manipulation, including surgical incisions. For example, during upper median laparotomy we perform incision from the xiphoid process to the umbilicus. In this case, the xiphoid process and the navel serve as the external landmarks. Again, during the anterior puncture of the shoulder joint, the puncture is carried out just focusing on the coracoid process. The coracoid process serves as the external anatomical landmark. We classify external landmarks in accordance with the tissues from which they are formed. On this basis, anatomical structures including bones, muscles, tendons, skin and vessels may serve as landmarks. Bone as external landmarks. Bones are the most stable structures of the human body and for that matter serve as a more stable external reference point. Our primary focus, of course, would be on bones and their features when we talk about external landmarks. Example, the greater trochanter of femur, iliac crest and different spines of the ilium such as the anterior superior iliac spine, are commonly used as landmarks.
Например, это различные ости подвздошной кости. Очень часто используемым ориентиром является спина iliac anterior superior. Большой вертел, гребень подвздошной кости и так далее.
Muscle as external landmarks. Muscles are also used as landmarks. For example, the middle third of the longest muscle in the human body, the sartorius muscle, coincides with the line of projection of the femoral artery and is used in the search this artery. The muscle is not only used in search of the artery but also as a guide to directly access the middle third of the femoral artery surgically. We also often use the edges of muscles as landmarks. For example, the bottom edge of the gluteal muscles is used for demarcation of the perineum region, the edge of the pectoral major muscle for the region of the armpit, and so on.
Мы также используем очень часто края мышц, например, нижний край ягодичной мышцы для отграничения промежности, край большой грудной мышцы для отграничения подмышечной области и так далее. Также используются и сухожильные ориентиры.
Tendon as external landmarks. Tendon are also used as landmarks, for example, the anatomical snuff box, which is formed by the extensor tendon of the finger. In the area of the foot, the tendons of the extensors of the toe and digits are used in the projection of dorsalis pedis artery.
Пальца и пальцев для поиска линии, на которую проецируется артерия дорзалис педис. В качестве наружных ориентиров мы также используем
Vessels as external landmarks. As external landmarks, blood vessels can also be used. Of course, most often it is the arterial trunks. However, the artery cannot be palpated throughout its entirety. We can feel the pulse only in certain anatomical areas where the artery is located, but firstly it must superficial and secondly on a bone.
областях. Только там, где артерия расположена, во-первых, поверхностно, а во-вторых, на костной основе. Сдавление артерии пальцами.
By applying pressure to artery against the framework of the bone using the fingers, the pulse can be felt. For example, in palpation of the carotid artery, the fingers are used to press the artery against the carotid tubercle of the transverse process of the sixth cervical vertebra. This criterion is used to study hemodynamics, such the presence of a pulse, its characteristics, in emergency situations. We also use these points, in this case the point of the common carotid artery, to temporarily stop bleeding.
Мы также используем эти точки, в данном случае точку общей сонной артерии, для временной остановки кровотечения.
In addition to the arteries, veins are sometimes used. For example, the external jugular vein, as a landmark, is used during puncture for the purpose of vagosympathetic blockade. By Vishnevsky method, it is pressed to the rear edge of the external border of the sternocleidomastoid muscle and thus, at the intersection of two lines, we get a point for the needle puncture.
задним краем musculus sternocleidomastoideus. И таким образом при пересечении двух линий мы получаем точку для вкола иглы. В качестве наружных ориентиров мы также используем
Skin as external landmarks. As external landmarks, we also use more or less permanent skin folds. For example, the three palmar creases, the proximal, middle and distal, can be used to project the arterial arch of the palm.
глубокие образования ладони, например, артериальные дуги ладони. Мы также используем в качестве ориентиров паховую складку.
Others like the inguinal crease and the crease under the breast are also useful, with the latter being used for access in the treatment retromammary mastitis.
При лечении ретромамарных мастит. Помимо наружных ориентиров, хирурги
Internal landmarks. In addition to external landmarks, surgeons mostly use internal landmarks. These landmarks allow us to understand the situation during the surgical intervention, for example, in the abdominal cavity. This requires, of course, a thorough knowledge of the anatomy and topography of different areas. Examples of internal landmarks include as ligament and pathoduodenal ligament, which is attached to the duodenum jejunum flexure.
лигаментум гепатодуоденале, троицева связка, к которой прикрепляется флексура дуодена юналис, ну и многие-многие другие образования. Значение наружных ориентиров настолько высоко.
The external reference points or landmarks are so important that sometimes lack them in an anatomical region one way or another make work difficult. I will repeat time and time again that we use external landmarks for diagnosis and treatment. They have very high clinical and practical importance for the doctor.
Практическое значение для доктора. Весьма часто в некоторых анатомических областях
Artificial landmarks. Very often in some anatomical areas, we are faced with limited external reference points, and this makes diagnosis and treatment difficult.
Например, в области грудной клетки мы имеем межреберные промежутки, ребра, но отсутствуют какие-либо дополнительные ориентиры. И для того, чтобы
For example, in the chest area, we have the intercostal spaces and ribs, but no further orientations to determine the depths of a pathological processes. In order to carry out biopsy or surgical incisions, we need additional guidance. As artificial external landmarks or conditional external landmarks on the thorax, we use projection lines like middle line, sternal line, parasternal line, midclavicular line and axillary line. In particular, we know that the normal localization of the apical pulse is the fifth intercostal space in the midclavicular line, about 1-1.5 centimeters medially from it.
точного толчка это пятое межреберье по среднеключичной линии 1-1,5 см внутри от нее. В области мозгового отдела головы практически отсутствуют наружные ориентиры, так как область
In the field of craniology, there are virtually no external reference points, since the region has a spherical shape. However, there is still the need to project structures located in the cranial cavity like different vascular formation, grooves and so on as patterns on the surface of the head. And to this end, we can build different projection lines, even topographical diagrams.
можем построить различные проекционные линии, даже схемы, топографические схемы, например, схема Кринлейна-Брюсовой. Данные линии, две горизонтальные линии и три вертикальные линии проводятся через наружные ориентиры, которые расположены.
For example, in the scheme of craniocerebral topography of Krenlin, 2 horizontal lines and 3 vertical lines are drawn on the cranium.
Проецировать различные структуры, например, центральную извилину, например, центральную борозду.
On this diagram, We can project the central gyrus and central sulcus on the anterior vertical line and middle meningeal artery, which is very often the primary source of intracranial bleeding. Syntopy. Syntopy is also a very important concept. It is the study of the topography of organs in relation to each other in the human body. Consider this description of the relation of the subclavian artery with other vessels as an example of syntopy. In this we say that the subclavian vein lies medially to the subclavian artery. Holotopy. Holotopy is the projection of an organ onto a particular anatomical region. For example, the heart is located in the anterior diasternum, stomach is located in the epigastrium and left hypochondrium. In other words, holotopy is said to be the projection of organs and structures located inside, on the surface of the human body, for example, on the surface of the abdominal wall. Skin. Practically all areas of the body is covered with skin except for a few areas that have no representation on the surface, as in the deep face and pelvic region. In all regions of the body the skin is expected to be the first layer. However, depending on one area and its functions, the characteristics of the skin may change. Three of these characteristics are, first the thickness, second the mobility, and finally the elasticity of the skin. In various parts of the body, the skin is characterized by its thickness. The areas of the body that face lots of pressure, like the palmar or plantar surface, are thicker than the areas that face less pressure, like the dorsal parts of the hand and foot respectively. The mobility of skin is more in the dorsal regions of the hand and foot, whereas it is less mobile in areas such as the plantar and palmar regions because of its connection with the plantar and palmar aponeurosis. Elasticity of the skin also differs. Example, on the dorsal surface of the hand it is more flexible, more extensible and hence more elastic as compared to the palmar surface, which is denser and, for that matter, less elastic. Skin derivatives. Another important feature of the skin is the presence or absence of skin derivatives in one area or another. The derivatives of the skin include hair, or hair follicles, sebaceous glands and sweat glands. Of course, if in an area there is one or more derivatives, we can talk about the morphological basis for the possibility of developing various diseases in that area. Hair follicles form a kind of small cavities in those places where they grow. The hair on the human body is available in almost all areas except two. These are the palmar surface of the hand and the plantar surface of the foot. Accordingly, in all areas except these two, pathological processes, which are based on the hair follicle, in particular boils and carbuncle, may occur. These pathological processes may lead to chronic inflammatory skin disease, which is an abscess and, accordingly, under the rules of purulent surgery, must be opened up, drained and irrigated. The sebaceous gland. The sebaceous gland is an appendage of hair, which enhances normal functioning of hair and provides the necessary characteristics of the skin.
Необходимой характеристики кожи является сальная железа. Сальная железа выделяет по
The sebaceous gland secretes its secretion through a duct that runs through dermis and epidermis onto the surface of the skin.
эластичность дермы и эластичность эпидермиса. И, соответственно, данный секрет является очень вязким.
The clogging of these ducts are key to the formation of a kind of retentional cysts, a condition that occur locally.
В условиях, которые возникают локально, данный проток может закупориваться и давать начало формированию своеобразных...
The cysts develop due to the influence of pressure created in the cavity of these organs resulting from blocked ducts. Around these cysts a kind of inflammation also occurs, as a result of inflammation of the fibrous capsule. Such retentional cyst arising from the sebaceous gland due to obstruction of its excretory duct is called atheroma.
И такая ретенционная киста, возникшая из сальной железы вследствие закупорки ее выводного протока, носит название атерома.
The likelihood of development of atheroma differs in different parts of the human body and in different areas.
В разных частях тела человека, в разных областях, вероятно,
This likelihood primarily depends on the characteristics of the skin in a particular anatomical region. The most important characteristic for the formation and development of atheroma is the thickness of the skin, because the thicker the skin, the longer the excretory duct, and the thinner it is, the shorter the excretory duct. And, of course, I think it is clear that the longer the excretory duct, the higher the probability of blockage, so it will get clogged more often than the shorter excretory ducts.
И, безусловно, я думаю, что это понятно, что чем выводной проток длиннее, тем вероятность его закупорки выше.
Therefore, in those areas of the body where the ducts are long, in other words where the skin is thick, there is a high likelihood of development of retentional cysts of sebaceous glands or atheroma.
То есть где кожа толстая. В этих областях вероятность развития ретенционных кист сальных желез или атером выше.
Example of such areas where atheroma occurs more often include the posterior surface of the human body, frontoparietal occipital region, back of the neck and spinal lumbar and gluteal region.
Затылочная область, задняя поверхность шеи, спины, поясничная область, ягодичная область. Именно в этих областях атерома будет встречаться.
In addition to the thickness of the skin, the density of the ducts in a particular region of skin also affects the likelihood of development of atheroma. The higher the density, the greater the probability of formation of atheroma.
Что также мы можем заметить в областях, расположенных на задней поверхности тела человека. Также дериватом кожи являются потовые железы.
The sweat glands. Sweat glands are also derivatives of the skin that secrete liquid secretion, but in contrast to the sebaceous glands, they are located a little deeper and are available in almost all areas of the human body.
во всех областях тела человека.
Histologically, depending on the way of secretion, there are three principal modes of secretions in the human body. These are merocrine, apocrine and holocrine modes of secretion. Mode of secretion of apocrine sweat glands involves secretion by budding or secretion by loss of cytoplasm. Apocrine mode of secretion is the basis for inflammatory diseases such as hidradenitis. However, this type of sweat gland is not found on the whole body in humans, but only in two major areas: the armpits and groin. These are the only areas where hidradenitis can occur, and therefore chronic inflammatory disease of the skin in other areas without apocrine sweat glands cannot be called hidradenitis. Subcutaneous fat and its internal fascia. In different areas of the human body, the relation of the skin to underlying structures varies. This has significant clinical importance as it determines the extent of spreading of purulent inflammatory processes. In most areas of the human body, the skin is unrelated to the underlying structures. That is, the skin has its own fascia or is related to only the superficial fascia but not the deep fascia. In these areas the skin has mobility since it is not connected or fixed to the deep fascia. Superficial fascia is a kind of connective tissue membrane that is underneath the skin and covers the whole body of the person. Unlike deep fascia, superficial fascia is not attached to the bones and does not form casings or sheaths for the muscles, but of course there is an exception. The exception is the attachment of superficial fascia of the thoracic region to the anterior surface of the clavicle. In this place, the fascia is a continuation of the second fascia of the neck as it attaches to the clavicle and descends to the front surface of the chest, forming a capsule for the breast in the subclavian area. This unusually thick superficial fascia which forms the capsule for the breast is called the suspensory ligament of the breast. The mobility of this ligament is highly compromised in breast cancer. Again, in such areas where the skin has no attachment to the deep fascia, the subcutaneous tissue is a single layer. And in this case, if there are pathological processes such as bruises or ulcers in the subcutaneous tissue, they often do not have a local nature and have the tendency to spread in all directions, as there are no structures for their limitation. Purulent inflammatory processes in such areas most often form phlegmons and diffuse abscesses. In contrast to this type of arrangement of skin and subcutaneous tissue, there is another type of arrangement where the skin is fixed by strands of connective tissue or fibrous fibers to a deep fascia. Of course, this fixation explains why in these areas of the human body the skin is slow-moving or even stationary. The subcutaneous tissue has a segmented structure in these areas. The segmentation is formed by the separation of the subcutaneous layer by fibrous tissues.
то есть разделена этими перемычками на своеобразные клетки или ячейки.
The segmented structure in turn explains why in these areas, purulent inflammatory processes are of a local character, appearing like localized abscesses or lumps.
Вид шишек или вид абсцессов.
There are only 5 areas in the human body with such arrangements. These are frontoparieto-occipital region, deltoid region, gluteal region, anterior or palmar surface of the hand and the plantar surface of the foot.
Поверхность стопы. В более глубоких областях залегают
The deeper layers.
мышечные слои.
Muscle are located in deeper layers. Several of the muscles lie in various organs, connective tissue bundles, and of course around bones.
Безусловно, костная основа. В глубоко расположенных слоях тела человека также встречаются и глубоко расположенные клетчаточные пространства. Например,
Subpectoral fascia and retroperitoneal space are also found in the deep layers of the human body.
если говорить
If we talk about fascia and its clinical significance, we need to talk about purulent inflammatory diseases such as abscesses and phlegmons.
об абсцессах, флегмонах, клетчатка является самой податливой, самой,
Adipose tissue is the most malleable and loose tissue of the human body.
разумеется,
Of course, Letishevsky enzymes of microbes in the first place destroy structures composed of adipose tissue, loose and fibrous connective tissues. We can speak primarily of the localization of these processes in accordance with anatomical regions, the occurrence of fat spaces and also the presence of tissue in the manifestation of these inflammatory processes.
говорить, конечно же, в первую очередь о локализации данных процессов в соответствии с анатомической локализацией, залеганием тех или иных клетчаточных пространств. А также мы рассматриваем наличие
The physiological role of fascia is also high, primarily because it serves as a shock absorber that reduces friction between surfaces of muscles and is therefore a protector, or buffer that surrounds very important structures including neurovascular bundles.
физиологии. Это в первую очередь, конечно же, амортизатор, который уменьшает трение между поверхностями, например, мышц. Это, конечно же,
In pathology, dissemination of purulent inflammatory processes occur along the same neurovascular bundles, and the fat around the bundles facilitate in the spreading of the purulent processes from one anatomical region to another.
вдоль тех же сосудисто-нервных пучков могут распространяться и гнойно-воспалительные процессы, так как клетчатка является не только местом локализации,
In deep areas of the human body, there are cavities within which are located organs and vascular nervous formations. Cavities formed by sheets of serous structures are called serous cavities. It should be noted that organs are located outside of serous cavities.
в которых расположены органы, сосудисто-нервные образования и так далее. Серозные полости или полости, которые
Examples of cavities in the human body include cavity of the pericardium, pleural cavity and abdominal cavity.
несколько в теле человека. Это плевральная полость, это полость перикарда, брюшная полость. Ну и, конечно,
Thus, if we consider the human body, first from the position of topographical anatomy and regional anatomy, then we'll see, of course, the differences of different areas, layer by layer.
тело человека, во-первых, с позицией топографической анатомии, то есть анатомии региональной или анатомии областной, то мы будем видеть, конечно же, различия в послойном строении.
As we progress in our study, we are going to see some of the layering structure of different areas. We will consider the clinical and practical significance some features bring. and how we can use these characteristics in the diagnosis and the execution of various manipulations when performing surgical interventions.
Данные особенности привносят и как мы можем эти особенности учесть при постановке диагноза и при выполнении различных лечебных манипуляций, при выполнении хирургических вмешательств.